everyone, this is Nawang and I will be talking about chronic kidney disease today. Alright, so introduction to chronic kidney disease. Chronic kidney disease is a long-term progressive condition where the kidneys gradually lose their ability to function properly over time. It is characterized by a gradual decline in kidney function, often lasting for several months or years. CKD can progress silently and lead to kidney failure if not detected and managed early. It is a global health issue affecting over 850 million people worldwide. And numbers are increasing due to the factors like diabetes, hypertension, and an aging population. This presentation will walk you through what CKD is, its stages, common causes, and available treatments. Alright, so here's the location of the kidneys right on the diagram over here. Kidneys sit just below your ribcage and behind your abdomen. Typically, one kidney sits on either side of your spine. Your kidneys reside between your intestines and the diaphragm. A ureter connects each kidney to your bladder. So what does kidneys do? Kidneys play several essential roles in our bodies. They filter blood, remove waste, and help regulate fluid imbalance and blood pressure as well. They also produce hormones like erythropoietin, which helps with red blood cells production, and renin, which regulates blood pressure. In healthy kidneys, these functions happen efficiently, but when kidneys function is impaired, waste accumulates and fluid and electrobalance is disrupted. Alright, so it's important to understand the pathophysiology of chronic kidney disease. Interstitial fibrosis, which refers to the abnormal accumulation of excess extracellular matrix, which is the ECM, proteins like collagen within the interstitial spaces of the kidney, leading to scarring and damage to the kidney tubules. Chronic injuries like infections and high blood pressure initiate repeated inflammation in the kidney's interstitial spaces. Key signaling molecule here is the transforming growth factor beta, which stimulates ECM production, including collagen and fibronectin. Over time, scar tissue replaces healthy nephrons, impairing filtration capacity and lowering GFR, which may lead to irreversible kidney failure. And then we have tubulo-interstitial fibrosis. This occurs when chronic kidneys injuries cause nephron death. The surviving nephrons attempt to compensate by enlarging hypertrophy, but this increases their metabolic stress, perpetuating further damage. This process results in gradual decline of kidney function proportional to extent of fibrosis. Okay, so here we have the formation of chronic kidney disease. Initial damage is when there's an injury to nephrons due to diabetes, high blood pressure, or ischemia. And then we have the progression, which is fibrosis formation, where excess extracellular matrix like collagen and fibronectin replace functional tissue. Epithelial mesenchymal transition, EMT, converts tubular epithelial cells into fibroblasts, promoting scarring. And then we have the end stage, where it's irreversible damage, which leads to end stage renal disease, requiring dialysis or transplantation. So here are the 5 stages of CKD based on the glomerular filtration rate, which measures kidney function. Stage 1 is when GFR is normal, but there may be some kidney damage. As CKD progresses to stage 5, kidney function declines significantly, and patients may require dialysis or a kidney transplant. As you can see, it ranges from mild kidney damage at stages 1 and 2, and then mild to moderate, and then from stage 4 it leads to moderate to severe kidney damage. And then for stage 5 we have the end stage of kidney disease, where the kidneys have completely failed, and at that point you will need to start dialysis or have a kidney implant. Understanding these stages helps doctors monitor progression and plan treatment to slow down the disease. Okay, so here are some symptoms of CKD. In the early stages of CKD, there may be no symptoms, which is why regular screenings are so important. As the disease progresses, symptoms like fatigue, swelling, high blood pressure, and changes in urination often become more noticeable. In the later stages, more severe symptoms like nausea, vomiting, and shortness of breath may appear due to the buildup and waste accumulation in the body. Risk factors for CKD. So, age is a significant factor as kidney function naturally declines with the age. Chronic conditions like diabetes and hypertension are major risk factors as well. Having a family history of CKD increases your likelihood of developing the disease. Certain racial ethnic groups, such as African Americans and Native Americans, are more susceptible to kidney disease due to their genetics and environmental factors. Lifestyle factors, including smoking, poor diet, and lack of physical activity, can all contribute to CKD risk. Alright, so here are some causes of CKD. Diabetes is a major cause because it damages kidney blood vessels. Hypertension, due to the high blood pressure, it damages kidneys. Glomerulonephritis is an inflammation of kidney filters. Polycystic kidney disease is a genetic condition causing cyst. And other factors, for example, smoking, obesity, family history, are also causes of CKD. But the two main we're going to talk about today is the diabetes and hypertension, so we'll be focusing on that today. Diabetes mellitus and CKD. Diabetes is the leading cause of CKD, particularly through a condition called diabetic nephropathy. High blood glucose levels can damage the kidney's filtering units called nephrons. Over time, this damage reduces the kidney's ability to filter waste, leading to CKD. Diabetes increases the risk of developing kidney disease, and CKD can worsen diabetes control due to the changes in kidney function. So, the management of diabetes and CKD. The main approach in managing CKD causes by diabetes is tight blood glucose control. Keeping the blood sugar level stable is crucial to prevent further kidney damage. In addition, medications such as ACE and ARBs are commonly used. These medications not only help control blood pressure, but also provide direct protection to the kidneys by reducing proteinuria and preventing further kidney damage. Hypertension and CKD. Hypertension is the major player in the development and progression of CKD. High blood pressure damages blood vessels in the kidneys, as I've mentioned before, and it impairs their ability to filter waste and fluids. As kidney function declines, it leads to more fluid retention, which worsens hypertension. This creates a cycle where CKD worsens hypertension, and uncontrolled hypertension accelerates kidney damage. Therefore, managing blood pressure is critical in slowing the progression of CKD. Management of hypertension and CKD. The target blood pressure of CKD patients is less than 130/80 mmHg. Controlling blood pressure can help slow kidney function decline. This can often be achieved with medications like ACE inhibitors, ARBs, calcium channel blockers, or diuretics, depending on patients' overall health and stage of CKD. ACE inhibitors and how they help treat CKD. ACE inhibitors like lisinopril work by blocking the enzyme that converts angiotensin 1 into angiotensin 2, a hormone that constricts blood vessels and raises blood pressure. By reducing angiotensin 2, these medications lower blood pressure and reduce proteinuria, which is important for managing CKD. ACE inhibitors are commonly prescribed in CKD, especially for patients with hypertension and proteinuria. They are essential in helping prevent the progression of kidney disease by reducing the strain on the kidneys and the blood vessels. Common side effects include hyperkalemia, which can be dangerous if not monitored, as well as hypotension, angioedema, a dry cough, and potential renal dysfunction, so regular kidney function tests are necessary. Angiotensin 2 receptor blockers is also another drug that can help CKD. ARBs such as losartan work similarly to ACE inhibitors by blocking the receptors that angiotensin 2 binds to. This prevents the effects of angiotensin 2, which helps lower blood pressure and reduces protein in the urine, a key feature of CKD. ARBs like losartan are often used as an alternative to ACE inhibitors for patients who cannot tolerate the side effects, particularly the dry cough. They provide similar benefits in terms of slowing CKD progression and managing hypertension. Side effects also are pretty similar as ACE inhibitors, including hyperkalemia, angioedema, dizziness, hypotension, and potential renal dysfunction. Monitoring the kidney function and electrolytes is important. Phosphate binders are another medication. Phosphate binders like sevelamer work by binding dietary phosphate in the digestive tract. This prevents phosphate from being absorbed into the bloodstream, helping lower phosphate levels. High phosphate levels in CKD can lead to bone mineral disorders, so these medications are important in preventing complications. Phosphate binders are especially crucial for patients with stage 3 or higher CKD, where phosphate levels can become elevated. Managing phosphate is important to prevent the development of conditions like osteodystrophy, which involves bone disease and mineral imbalances. The most common side effects are gastrointestinal issues such as constipation, diarrhea, and nausea. These can usually be managed by adjusting the dose or switching to a different binder. Here's another med that we have: erythropoiesis stimulating agents, ESAs like ipodin alpha, which helps stimulate the bone marrow to produce red blood cells. In CKD, kidney damage leads to decreased production of erythropoietin, the hormone responsible for red blood cell production, causing anemia. ESAs are commonly used in CKD patients when their hemoglobin levels drop. It's important to monitor hemoglobin and iron levels, as excessive use can lead to an increased risk of cardiovascular events. Potential side effects of ESAs include hypertension, as the increase in red blood cells can raise blood pressure, and an increase in thromboembolic events such as blood clots, especially if hemoglobin levels rise too quickly. Then finally, we have the diuretics. Diuretics like furosemide work by increasing urine production, which helps eliminate excess fluid from the body. This is especially important in CKD patients who may develop fluid retention and edema, which can worsen their condition. Diuretics are often used in CKD patients who also have heart failure or those with stage 3 or higher CKD, as they help manage volume overload, a common issue. It's important to balance fluid loss to prevent dehydration while controlling edema. The most common side effects include electrolyte imbalances, particularly hypokalemia, dehydration, and hypotension. Regular monitoring for kidney function and electrolytes is essential when using diuretics as well. So here are different types of dialysis. Dialysis is a life-saving treatment option for patients with end-stage renal disease or severe kidney dysfunction. There are two primary types of dialysis. We got hemodialysis. In this procedure, blood is removed from the body, filtered through a machine, and then returned to the body. This process usually takes place in a dialysis center and occurs multiple times per week. It is the most common form of dialysis. Next, we have peritoneal dialysis. This method uses the lining of abdomen or the peritoneum as a natural filter. A special fluid is introduced into the abdominal cavity to absorb waste products, which are then drained. This form of dialysis can often be done at home, and it can be performed either manually or through a machine at night. What are some indications for dialysis? So dialysis is typically needed when kidney function drops to less than 15% of normal. At this point, kidneys are no longer able to remove sufficient waste products or regulate fluid balance, leading to life-threatening complications. Some common signs that dialysis is needed include severe fluid overload, high potassium levels, uremia, which is a toxic buildup of waste in the blood, and acid imbalances. So, when is transplant an option? A kidney transplant is considered for patients with stage 5 CKD, when kidneys can no longer function on their own. It improves quality of life and removes the need for dialysis. What's the difference between living versus deceased donors? So, kidneys can come from living or deceased donors. Living donors offer better long term function but require compatibility and willingness. Deceased donors are more common, but wait times can be long. Immunosuppressive therapy. Post transplant, patients need immunosuppressive drugs to prevent rejection. These medications can increase infection and cancer risk, so careful monitoring is still required. Some challenges include donor shortages, long waitlist times, and the need for long-term care after the transplant to monitor for rejection and manage medications. Patient education is very important for CKD. Diet, exercise, smoking cessation, and regular monitoring, these are all important factors. Dietary modifications are crucial in managing CKD. A low sodium and low protein diet helps reduce the workload on the kidneys and minimizes fluid retention and high blood pressure. Patients are also often advised to follow fluid restrictions to prevent excessive fluid buildup in the body, which can stress the kidneys and the heart. Additionally, limiting potassium and phosphorus intake is necessary to avoid dangerous electrolyte imbalances and prevent complications like hyperkalemia and bone mineral disorders. Regular physical activity is key lifestyle modification for CKD patients. Exercise helps manage weight, blood pressure, and blood glucose levels, all of which can contribute to kidney health. It also improves circulation and reduces the risk of cardiovascular disease, which is often associated with CKD. Patients should aim to moderate intensity exercise, such as walking or swimming at least 30 minutes a day, 5 days a week. Smoking cessation. So, quitting smoking is critical for CKD patients. Smoking can worsen kidney function by promoting inflammation and reducing blood flow to the kidneys. It also accelerates the progression of kidney disease and increases the risk of cardiovascular complications. Smoking cessations can significantly slow the progression of CKD and improve overall health. One of the key considerations for CKD is the avoidance of nephrotoxic medications, including over-the-counter NSAIDs like ibuprofen, naproxen, and aspirin. These medications can cause kidney damage by reducing blood flow to the kidneys and interfering with their normal function. Long-term or frequent use can lead to acute kidney injury or exacerbate existing kidney damage. CKD patients must discuss all medications, including over-the-counter drugs, with their healthcare provider to ensure that they're not harming their kidneys. Regular monitoring. CKD patients need to stay up on top of their health by having regular checkups with healthcare providers. Monitoring kidney functions through lab tests like creatinine, glomerular filtration rate, which is the GFR, and urine protein levels is essential to track disease progression. Regular checkups also allow for early detection and complications, adjustments of treatment plans, and reinforcement of life modifications. Support system also plays a vital role in patients' journey with CKD. Counseling services provide emotional support, especially for patients coping with stress and anxiety of chronic illness. Support groups are particularly valuable because they connect patients with others who are going through similar experiences, helping them feel less isolated. In addition to in-person support, online resources and educational websites can provide reliable information and tools to help patients better manage their conditions from home. Alright, thank you all for listening, and here are my citations.